Good morning and or afternoon to all of our attendees. Thank you for joining the AAMC for Applying During and After the COVID-19 Pandemic, What's Changed? I'm joined today by several colleagues from the admissions community and one from the Texas Centralized Application Service, Rafael Rivera, Christina Grabowski, and Enrique Hasso. Now I will turn things over to Enrique to get us started today.
Good morning, everyone. My name is Enrique Hasso, and I am the Associate Director of the Texas Health Education Service here in Austin, Texas, inside the Tmdsas office. I'm representing Tmdsas, which has been around since 1968, where it initially began as an application service for just UT's dental and medical schools. But as you all know, we've grown to include all public dental, medical, and veterinary schools in Texas, and recently welcomed Baylor College of Medicine to the application service starting this application cycle. So, as I mentioned, Tmdsas shares an office space with the Joint Admission Medical Program, which provides a pathway to medical school for economically disadvantaged Texas residents, as well as the Texas Health Education Service, which is the outreach and education branch for our organization. We amplify the reach of both Tmdsas and JAMP, as well as that of our 19 member institutions and the pre-health community in Texas, which is made up of our health professions advisors, counselors, and aspiring and current applicants. Part of our member institutions, our 19 institutions, include 11 allopathic schools, 2 osteopathic medical schools, 4 dental schools, and 2 veterinary medical schools. All 13 medical schools participate in the Tmdsas match, which facilitates the admissions process for Texas resident applicants, as well as our member medical institutions. COVID-19 presented a very unique situation for everyone. And in our organization and our member institutions, we're not shielded from that. Throughout the application cycle, we actually met regularly with our member schools and remained in close contact with our colleagues both at AAMC as well as the other application services to ensure that our procedures were reflective of the situation. And as part of that initiative, we also expanded our flexibility to our applicants to ensure that we maintained an equitable process for every single applicant that came through our system. This led to our member institutions issuing guidance on accepting pass-fail or credit, no credit courses for many students who had to move from an in-person learning experience to online, as well as online prerequisites being accepted as part of Tmdsas. Currently, that regulation is active through spring of 2021. And we are looking into expanding that into the summer and the fall as well. And we also extended our application service and our interview cycle for this year. As a reminder, you can submit your Tmdsas application even if your letters of evaluation and test scores are still pending. Your transcripts will not be submitted until they are requested at the time of admission by Tmdsas. One of the resources that we provide through the Texas Health Education Service and Tmdsas is the Inside Health Education Newsroom. And through this newsroom, JAMP, Tmdsas, and the Texas Health Education Service combine efforts to produce a dedicated virtual space for aspiring pre-dental, pre-medical, and pre-veterinary professionals. This platform allows us to reach you directly, promote our professional schools, and expand the renowned collaboration of Tmdsas to bring pre-health advisors and professional organizations together in support of our future health professionals. Part of the updates that we've sent out through the Inside Health Education platform is that for entry year 2022, you are now able to access the Tmdsas application handbook, which is a step-by-step guide of the Tmdsas application, as well as our timeline for this next year. Just to provide you a quick overview, the application will open on May 3rd this year, although you will not be able to submit your application until May 17th. Following the extended application cycle that we saw last year, the deadline for submitting applications this year will be November 1st. Offers of admission for out-of-state applicants and pre-match offers for Texas residents will begin on October 15th through January of 2022. And the Tmdsas match for this application cycle is scheduled for March 4th. We also welcome you to stay up to date with Tmdsas and the Texas Health Education Service by joining our newsletter and our online communities. We have the Tmdsas Hub, which is open to all applicants, current and future, as well as the Tmdsas non-traditional applicants groups on Facebook. Over the past year, we've worked to address applicants' needs and advisors' questions as well to make sense of all of the changes that have happened. Through our Courage Session series, we're able to bring member institutions and advisors to help answer your questions through a live Q&A series. We also broadcast this through our podcast, the Inside Health Education Podcast, which joins a library of over 80 episodes that are tailored to address questions throughout your journey. Through the Courage Sessions, we've also discussed how COVID has affected each school's review process. We've discussed issues like canceled activities, virtual shadowing opportunities that you may have experienced over the past year, staying engaged with your goals throughout the pandemic, and we've assessed the historic growth that we saw here at Tmdsas for all application types, but primarily the medical and veterinary schools. Just saw explosive growth that was over 20% growth over other cycles. If you're interested in any more of these resources, we welcome you to hold up your little camera phone to the QR code, and it'll take you to a dedicated page that's just a little cheat sheet that takes you to any section of the website on the Tmdsas side that will help address any questions that you have. And of course, I will be around to answer any questions that you have later on today. But next up, we'll be moving on into our next poll. Which of the following activities have you been able to participate in this past year? So please fill out this poll to help us kind of gauge who you are and what activities you've engaged in this past year. And now I'll pass it over to Christina Grabowski from the University of Alabama, Birmingham.
Hi, everyone. This is Christina Grabowski, and I am the Associate Dean for Admissions and Enrollment Management at the UAB School of Medicine in Birmingham, Alabama. And before I get to talking about UAB, I want to share a little bit of results from the first poll. I know you all are working on the second poll, but want to have you take a look here at how many of you have delayed your application due to COVID. It looks like sort of a mix between the group. Half of you, or roughly half of you, have delayed applying and the other half have not. And we're finding that across the country. You have to make a decision based on your own preparation and your own situation. And we in medical schools completely understand that. Okay, so let me tell you a little bit about UAB School of Medicine and what we've been doing sort of in response to the COVID pandemic. So we're a public medical school in the state of Alabama, and we enroll about 186 new students each year, so a large medical school in the South. We're located in Birmingham, which is about 1.2 million people, and we're an academic medical center. In fact, we have the third largest public hospital in the United States, so a really large academic medical center. At the same time, we have 4 campuses for clinical education. It includes 3 campuses that would be more community-based medicine. And so we have opportunities for students both interested in academic medicine as well as community-based medicine. We have 10 ranked specialties in our residency programs, and we have multiple key mission areas. As a public institution, as you can imagine, serving the state of Alabama is extremely important to us, and as well as an academic medical center, we're known throughout the country and the world for research and innovation. We have mission areas in diversity, medical disparities, and meeting those needs, research innovation. We have rural medicine programs as well as a primary care track. So let's talk a little bit about COVID and the impact on admissions. I know this has been a really stressful time for all of you, trying to figure out what activities can you get involved in, what are medical schools going to think about your activities, what about changes in coursework and how things are graded, all of that. And so I'm going to try to address what we've done at UAB. But first, let me just say that we as admissions deans across the country understand that there's impact. We understand that your application isn't necessarily going to look like applications 2 years ago. We are adjusting, we are understanding, and we're going to give you opportunities to explain your experiences to us so we can understand the context of all of what you've been doing as a pre-med. So a few specifics. In terms of pre-medical education, you all have probably had some virtual classes you would not have had before, and previously many medical schools wouldn't take online coursework. Now many of us are, and you can look in the MSAR, which we can tell you a little bit more about later. It's the Medical School Admissions Requirements resource through the AAMC, or on our each individual websites to learn what we're doing. At UAB, we're allowing virtual classes when the school has switched to virtual. We're allowing pass-fail grades in coursework for students, particularly last spring and into the whole year, the first spring and then all last year. If you were from home and not sure and uncertain, certainly you may have opted for pass versus grading. I will say that if you have the opportunity and you feel supported and you can get a grade, many schools are going to want to see your true performance in the coursework. But there are reasons certainly for going pass-fail. We are also accepting online labs. So that's sort of the academic piece, and happy to answer questions about that as those come up later. So restricted access to experiences. Listen, you have to be safe. First and foremost, whatever it is that you're doing, you need to make sure you're following the CDC guidelines to be safe. We know that access to shadowing, for example, may be very different now or non-existent. You may not be doing the same service activities that you were planning or had started, or extracurricular activities. We're going to ask you to tell us what you have been able to do and if you've been able to find new avenues to grow. We're looking for your inter and intra-professional competencies through these experiences, as well as your journey to medicine. And so whatever it is that you're doing, you want to be able to tell us why medicine. You want to be able to tell us a little bit about how you've explored medicine, interactions, interviews with physicians, interviews with patients, whatever that looks like, so that we can understand your knowledge in terms of a career in medicine. We're going to want to see, that you've interacted with others, even if it's online or virtually, in terms of service and your sort of your helping heart, right? And then for interviewing has been a bit of a challenge for a lot of us in that we've had to flip to a virtual interview platform, and so you may need to ask for resources if you're not able to get onto Zoom at home or have a quiet space and all of those kinds of considerations. We'll be interviewing virtually into the new cycle at UAB. All right. Quickly, I just want to share the importance of a holistic review. A holistic review means we're giving individualized consideration to each of your applications to learn about you and how you're going to contribute both to our learning environment as well as to the profession of medicine. And so we're going to read qualitatively. It's not all about the numbers and the data that come in through the application. We're going to read very closely all the information that you're providing to understand the context of your preparation. So we're going to ask you, we've added some prompts to our secondary at UAB about learning about the impact of COVID, and we're also asking some questions that focus in on your competencies, what you know, quality, not necessarily the quantity of the activities done, although certainly we want to know that you've done what you need to do to be prepared. We're really going to try to hone in on, are you prepared in the ways that we would like for you to be. We give balanced consideration of experiences, attributes, and academic metrics in our process. So the other thing that I'll add for UAB specific, and then we're going to look at some poll results from the second poll, is to really, this is my tip for all pre-meds. We do a checklist often when we're trying to reach a goal or get somewhere, and we say we got to do this, we got to do that. We check it off our list. I'd like for you to take time to reflect on your experiences and your preparation and be ready to tell us about what you observed, how you grew, what you learned in the process, because that qualitative stuff is what we're really looking for in our essays and our questions. How did those experiences prepare you for a career in medicine? What kind of physician are you likely to be? Do you understand a patient perspective and what it means as a physician in terms of caring for others? How did your experiences confirm your desire to go into medicine? So think about reflection, and each activity you've done, sit down and write about those activities. That will help you in the process. All right, so let's go back to our poll number 2, where we asked which activities have you been able to participate in the past year, and I'm going to send those results so you can see them too. It looks sort of fairly balanced, although it looks like personal and professional development, that including reading articles and watching videos and learning more about health disparities has been the activity you've done the most, which is not surprising, right? You've had access to that in a COVID era. Remember that those are activities that you should be telling us about on your application, even if they feel more passive than active. We want to know what kind of exposure you've had to these things. And I love the watching Netflix and Hulu piece. I think we've all been doing a little bit of that, more so maybe than normal. All right, so I am now going to launch another poll for you so that you can take a look at another question so we can gather that information. And I will hand off now to Rafael. Rafael?
Thank you, Christina. Hi, everyone. I'm Rafael Rivera. I'm the Associate Dean for Admissions and Financial Aid at the NYU Grossman School of Medicine and a pediatric radiologist at NYU Langone Health. A little bit about our school. We are a private institution that was founded in 1841, and we enroll each year 102 students into our entering classes, about 92 into the MD program and 10 into the MD PhD program. I want to emphasize there are an abundance of phenomenally great schools throughout the U.S. Any one of them is going to train you ideally, and your job as a student is going to be to identify what would be an ideal fit for you medical school-wise. And some of the ways that we try to differentiate ourselves for folks is, geography is one part, right? So we're located in Midtown Manhattan by the East River in New York City. We have 4 private hospitals, a public hospital in Bellevue and a government hospital, so within easy walking distance. You can see every aspect of healthcare present today, serving the diverse patient population of New York. We offer a 3-year MD program, an accelerated 3-year program that allows you to not only graduate in 3 years, but also is linked to any one of our 21-plus residency programs. And that's in addition to 4-year MD programs, 4- and 5-year dual degree programs, and of course the MD PhD program. And then in 2018, we became a tuition-free school, awarding full tuition scholarships for every MD student for the length of their medical training, really to drive down debt, and that really works synergistically with the 3-year MD program. That's a little bit about us. COVID really, has appended things for both applicants and admissions committees, and when I look at the impact on applicants, right, Dr. Grabowski described the holistic review process that admissions committees use. Specifically the EAM model that the AAMC has espoused. I like the EAM model because it's really one that encourages a balanced view of every applicant, all aspects of an applicant, right? And E stands for experiences, right? A stands for attributes, and M stands for metrics. And that helps guide committees in how they look at folks. But I thought for the purposes of this talk that it would be useful to look at that framework from the perspective in terms of how it impacted applicants and their applications in the wake of COVID. So starting with the experiences, right, it's clear that, once COVID hit, a lot of those in-person activities, dried up and dried up pretty quickly. Folks used to do these 3 things, really for 3 primary reasons. one, to learn about the suitability of medicine as a career choice for them, right? You want to know that what you're getting into is what you're going to want to be doing for the rest of your life. Two, to give back to society and to give back to the communities you're a part of. And then three, to demonstrate to admissions committees your dedication, your passion for medicine. But, if there's one thing that has always impressed me about applicants, it's how resilient and how resourceful they are. And schools and institutions have quickly stepped up to provide these applicants with a variety of different virtual experiences. So as Dr. Grabowski described earlier, things may have changed in terms of the opportunities that you have, to demonstrate your interest in medicine by way of volunteer shadowing, scribing, and so on. But it's your opportunity to individualize yourself, to really take advantage of the new opportunities that are present for folks. We see some questions coming through in terms of how people will respond, how they will be viewed if they don't have the same ability to do those same in-person activities. I think it's important to also recognize that this is impacting all applicants at the same time. So, admissions committees are recognize the difficulty that this imposes on folks to be able to get some of those experiences. But the flip side is it also opens up the opportunities, right? Because it may be easier to do some of these volunteering activities if they're virtualized. So there are both, challenges to overcome and opportunities there as well. With regards to the metrics portion, right? So, schools quickly changed over to online courses, online labs, and, to be perfectly honest, I'm a huge fan. I like online courses. I think online courses are great for a variety of reasons. One, it makes efficient use of people's time. It scales very easily, and theoretically, it should decrease costs for folks. As for grading, right, schools also transitioned temporarily over to a pass-fail grading model, right, and that made sense as people were dealing with the turmoil of COVID as it first hit. But as Dr. Grabowski noted, we would like to see, if possible, if your school offers letter grades, we would definitely prefer that. And of course, the MCAT remains a mainstay in terms of the metric model for us at NYU Grossman and a lot of other medical schools. Not because we want to stress anybody out, but because it does predict performance in medical schools. And I have to give kudos to the DLNC and in particular the MCAT team for safely expanding access during the pandemic and really reducing the amount of time that it takes them to get us admissions committees their scores. So, I focused on the E and the M here in the model, but it is important to recognize that the A of the model also can be positively impacted by what's happened with COVID, right? So your ability to expand your personal interests, your ability to do things with the free time that you may have had, things like learning another language, those are the opportunities that people can use to really make themselves stand out as an applicant in this or future upcoming cycles. So just as it was impacting applicants, it was impacting admissions committees across the country. It's been noted how many more applications medical schools have received this cycle, right? So the WNC has reported that applications that have increased nationally some 18%, and some folks call it the Fauci effect, right? Seeing the impact that frontline healthcare workers have had in stemming the tide of the COVID pandemic. That has really driven folks to recognize how important physicians are in the health and well-being of our society. And that's played, I think, a key role in the increase in the number of people applying. But it has made things more difficult, in terms of screening those thousands of applications, right? That there are schools that are getting 15,000+ applications to screen. And one of the things that we've been working on, that we've created a couple years ago that has helped us during this surge of applications is a machine learning approach to screening, right? So we have an AI screening algorithm that really learns from some 6 to 7 years of faculty screening decisions to be able to replicate their decisions in near real time. And the beauty of that is that it dramatically improves our ability to screen. We can get people a decision dramatically faster. You can screen, you can scale up depending on how many people apply without any need for GPA or MCAT cutoffs. Like I said, it decreases the turnaround time. And most importantly, it reduces the impact of individual bias, right? So it really adds to our diversity, equity, and inclusion efforts. So that's one way that we've been managing to keep on top of the surge of applications. As others have mentioned, interviews, right? That was challenging for folks. Committees had to turn on a dime and change their well-established in-person interviews to virtual ones. But here too, I see that this is a great opportunity for folks. Why? Because virtual interviews allow us to help level the playing field for applicants. It increases the equity for applicants. It decreases the impact of socioeconomic forces, right? We're big fans of reducing the cost of medical education, and the cost of a medical education starts with the cost of applying to medical school. So if you can decrease the travel cost, then everyone benefits. It allows applicants to interview at more schools so that they can better identify what would be a great fit for them. And it also is safer for folks, right? Dr. Grabowski described how safety is always our primary concern, and not having to have people travel extensively across the country for interviews is another benefit. One additional benefit that I'm hoping will come out of this is I am a firm believer in the multiple mini-interview format as an ideal way of interviewing, but I recognize that it comes with logistical challenges and disadvantages for medical schools, not the least of which is the physical space that is required to conduct these interviews. Now with virtual interviews, some of those limitations then start to go by the wayside. And so I'm hoping that this is a format that then it becomes more easily used by admissions committees across the country. With regards to acceptance, I think hand in hand with virtual interviews, rolling admissions works very well. I'm a big fan of rolling admissions because it allows us to get decisions early to folks, ideally within 2 to 3 weeks of when they interview. And the beauty of that is that it allows us to meld virtual and in-person activities. And that's going to be, I think, the subject of things moving forward, right? So once accepted, right, we would bring back those accepted students back onto our campus so that they can meet our faculty, they can meet our students, they can do in-person tours. And that'll all complement quite nicely with the virtual tours that we have and the various Zoom sessions with students and faculty. Again, moving forward, I think that hybrid approach is one you're going to be seeing coming from many medical schools across the country as they try to, for better or worse, make lemonade out of the lemons that COVID has given us this year. So I'm looking forward to being one of the folks who can help answer questions for folks. But on this note, I'd like to hand it off to Nashika Knight for questions.
Thank you, Raphael. We will transition in one moment to our questions. We see several questions coming in, but we have one final survey question for you all. So if we could please send that last survey, Marla.
Okay, they answered the survey. We just put up the results.
Perfect. Thank you so much. There are a ton of questions coming in, so this should be pretty robust discussion. And I wanted to remind you, if you haven't had the time, yes, please send your questions in now through the Q&A feature, and we'll get to as many as we can. The first question is, last year's application cycle was different because deadlines were probably more lenient due to COVID, especially for rolling admissions. How about this year, generally speaking? For example, is taking the MCAT later in the application cycle okay, or should I just apply next year to be as advantageous as possible? And I'll direct that to any of our panelists.
This is Christina. I'm happy to take it first. So I think that, in previous years before COVID happened, there was definitely an advantage to applying early in a cycle, I think for most schools. However, still, students who applied later in the cycle in a holistic review process would still be reviewed, right, at most schools. Certainly at our school. We reviewed every application no matter when it came in. However, a lot of interview slots were already filled by the time we read applications that were later in the cycle. So the reality is, I would have said, if you can apply earlier, do. If you have a strong application and you're going to apply later, still apply, right? That would have been my advice pre-COVID. Now, with how we slowed things down last year and understanding that there may still be some delays this year in terms of students who are taking coursework they weren't able to take because of COVID, or other kinds of delays, getting more experiences in now that things are starting to open up, we will be deliberate in terms of reviewing later, and there will be no disadvantage to applying later in the cycle for us. Dr. Rivera, is that the same for you?
Yeah, exactly. We've always sort of portioned out our interviews based on historic trends and when applicants apply. We have seen that the largest number of applicants really hit our servers in the months from roughly July through September, and at that point it starts weaning down. But we would nevertheless, in an effort to ensure that every applicant who submitted by our relevant deadlines was fully reviewed, we would hold out interviews, and we would portion out those interview invites as the season went along. So yeah, I agree with Dr. Grabowski that if anything, this season makes it even more equitable for folks. The important thing is to make those deadlines and to apply when you feel that you are ready and when you can put your best foot forward. I talked about the screening algorithm that we use, and one of the beauties of that too is that it evaluates applicants the same whether they're applying in that early pool or towards the latter part of the pool. Again, I think the timing is individualized. It's something you should be discussing with your pre-health advisors at your school, and identifying when it is that you feel you are at your best for putting in that application to med school.
Thank you. I'm glad that you mentioned your screening tool, Dr. Rivera. I have one question for you, and then Enrique, I think you were going to comment. So the question is, what steps have you taken to ensure your AI algorithm isn't propagating human bias or inequality in screening?
Exactly. Yeah, that's one of the dangers with all of these machine learning AI type algorithms, right, is that you have to recognize they can only be as good as the process that they are trained on, right? So before we even thought about developing such an algorithm, we ensured that right from the start that the admissions process looked at DEI at every step, right? We're talking about our recruitment strategy, we're talking about screening, interviewing, the admissions decisions, what that entire process is done, and also training. But one of the ways I think that the algorithm and any sort of algorithm like this can improve things is when you look at how those decisions are made, right? And I think Quinn Capers put it well in a paper he and his team wrote several years ago, which is that you try to create as equitable a process as possible, and you select folks on the committee who adhere to the institution's mission on diversity. But there's a limit to how you can screen out, how you can remove unconscious bias from any person, right? We know that conscious bias is a lot easier to tackle than unconscious bias, and it's difficult to weed that out completely. And if you have a system like we used to have, where we would have 2 faculty members who would screen each application to try to improve it over one faculty member, you're still sort of beholden on both of those people being free from any sort of bias, right? And if one of those persons has an unfair bias against an individual, then that impact on that applicant is outsized. Now, flip that around where you have an algorithm that's been trained on 35 plus different screeners over the course of 7 or 8 years. It minimizes those negative unconscious biases that folks may have, and instead replaces it with an institutional value set. And if the institution values diversity, then that is what shows through. And so our experience with the algorithm has been that, yes, it's a decision support tool, and it's still, so it doesn't make decisions for folks, but it is a useful tool in helping us to expand the diversification of our applicant pool, right? And our entering class last year was 27% underrepresented in medicine, and this year it's, the accepted pool thus far is 30%. So, it is, again, a useful tool if it is thought out properly from the beginning.
Thank you so much. Before we move to the next question, Enrique, I think you wanted to comment on the previous question.
I did. With regards to TMDSAS, we have a different application cycle for our medical schools. And so I just wanted to point out that in addition to everything that was previously said, yes, TMDSAS schools do also allocate spots for applicants who are submitting later in the cycle. With the extended application and interview cycle that we used last year and are now implementing for this application cycle as well, we will continue to do so. But it's still very highly recommended that you submit your application as early as possible, but also balance that with submitting a quality application. You know, when you submit your TMDSAS application, you're not required to send in your test scores or your letters of evaluation, so you're able to submit your application pretty quickly. But you do want to balance that to make sure you submit a quality application, because I'm sure all my colleagues here will know of several instances where applications may be incomplete, or there's a placeholder, or there's just bad information that was entered. And unfortunately, once that application is submitted, that's how it goes. So that's actually one of the reasons why we wanted to allow this 2 weeks that we've implemented between the opening of the application cycle on May 3rd and the first date that you can submit an application on May 17th. So that will allow you sufficient time to go back and review your application. Now, if you have a later MCAT test date, please do submit your TMDSAS application first. We do not require your test scores in order to submit those to the schools. But as soon as your scores come back, do release those to TMDSAS, and we'll transmit them to the schools, and we'll continue building your application that way.
Thank you so much. So now, Marla, I think we're ready for the results of the third poll to go to the audience, because we have 2 questions related to that. So one question is, are we expecting to have more applicants this year too? And a related question is, if so, how do you recommend that applicants distinguish themselves from the rest of the large application pool? And I'll direct that to Christina.
Sorry about that. I was on mute all. So do we think we're going to have a larger amount of applicants? Is that the question? I was looking at the poll results. Yeah.
Well, yes. Will we have more applicants? And if so, how do you recommend that applicants distinguish themselves?
Okay, very good. Thank you. So it's interesting, you know, we had such a jump this year. We're all wondering whether we'll have more applicants or whether applicants who would have applied this next cycle applied a year earlier because they didn't figure there was anything else they could add to their applications during the year because everything was going to be so restrictive. So we don't know. Others may have, my colleagues may have other thoughts on that. We're really not sure what the application pool will look like this year. What I can say is that we do believe that in coming years that we'll have increases in interest because what folks are calling the Fauci effect, folks who are becoming interested in medicine from what they've learned and all of the exposure they've had to taking care of people and through the press and everything else. So we think that for years we're going to see folks who maybe became motivated to go into medicine. But as you all know, there's a lot to do to apply to medicine, so likely that wouldn't happen immediately. It would take some time for that sort of new sparks of interest for people to impact numbers. But in terms of standing out in an application process, my advice would be any year the same. Reflection. Thinking about what you've done, why you've done it, what you hoped to learn from it, how you did learn from it, how you grew, and making sure that all the narrative that you put in your application tells your story. Sometimes, the thing that I worry about are the students who just give the facts, right? So if they're talking about shadowing, I shadowed this kind of doc for this many hours. Okay. But what did you witness? How did it impact your thought about medicine? Confirm maybe your interest in medicine. What did you observe that you learned from that you'll take with you into the profession? So think more broadly about why it is that you're doing the things you're doing. And how those things have impacted you, and tell us stories about that. Explain, describe. Obviously, you only have so much space, so make sure that you're being careful and taking your time and having a quality response, and that you're proofreading. But I think it's taking all the opportunities you can to tell us your growth and your journey. I think that's how you really stand out. You certainly want to continue with activities even after you submit your application, because the next stage is interview, and there are going to be opportunities in the interview to talk about how you've grown even since you submitted your application. And I also often tell students, sometimes students have to apply a second year. So you don't want to prepare for medical school, submit your application, and stop doing all the things that we've been asking you to do, because the reason we're asking you to do these things is so that you grow and you'll be a phenomenal physician, not so that you can get into medical school. So continue growing and learning even after you submit, because those lessons will come in handy in the future.
Yeah, I just wanted to add to that, because I think, Dr. Grabowski's comments are spot on. In terms of the number of applications, it's hard to tell. I don't think anyone really predicted that we would have this much of a surge, right? The number of applications has been increasing steadily each year by just like a 2-3%, whatever the number may be, but not the 20%. And it's possible that the numbers may continue to increase, but by a small margin. May be possible that even they may decrease next year, depending if everyone sort of applied now. We'll find out next year. But with regards to how things, how you stand out as an applicant, I would say, it's really paying attention to what it is that you want out of medicine, right? When I hear folks who ask me, what are the things I have to do to get into medical school, essentially asking, what checkboxes do I have to fill to get in? Well, that is a good way to not stand out, right? Because you are then doing what everybody else does. And each medical school will be looking for different things in students, because they each have slightly different missions. And that NYU Grossman, for example, I would rather have somebody who has a vertically oriented interest in a specific area rather than a jack of all trades, master of none, right? So as Dr. Grabowski says, right, when you look at your application, you look at the experiences you've had, I should be able to predict what your personal statement is going to read just by looking at the choices you've made in those experiences, right? That should also tell me a lot about your character as manifested in what your letter writers should say. And, I think folks sometimes try to spread themselves a little too thin in doing a little bit of shadowing, a little bit of research, even if they don't want to do that. Whereas, from my view, that's the job of the admissions committee, is to identify in its workforce, what the optimum percent of the classes is going to be focused on clinical activities, what percent of the class will be focused on the research mission, and what percent will be going on to be medical educators down the road, right? So for us, like I remember one applicant who applied many years ago whose interests were in increasing the access to reproductive endocrinologic techniques, and it's sort of unique, right? But her research, her community service was on broadening access to folks who couldn't afford this but wanted to have a child. She spent years working with reproductive endocrinologists, and so she had people who wrote her great letters. She stood out because it was clear to us what she was passionate about in medicine and how she would impact the healthcare once she became a physician.
Thank you so much. There's several questions about virtual interviewing, and we're getting really tight on time, so I want to make sure we get to these. So one question is, most schools held virtual interviews this year, and this will likely continue in the 2022 cycle. Based on your experience, what tips would you share with applicants for successful virtual interviewing? And if our panelists can keep their responses pretty succinct, then I think we can get to a couple of other questions. And either of our panelists can weigh in on this.
This has been a topic of discussion here at Tmdsas. Unfortunately, this past year, while this virtual interviewing has offered a lot of opportunities, which are fantastic, especially in Texas, to get from El Paso medical school to get to the Houston medical school, it's about an hour and a half plane ride both ways, and it's very difficult to travel within Texas. But some of the newer issues that we've encountered are interruptions during your virtual interviews, distractions in the backgrounds that are going on, and really just a lack of engagement. Unfortunately, I think we've all kind of reached kind of this Zoom fatigue mode, and it showed up several times during our virtual interviews with some of our schools. Later this summer, when interviews begin again, we're actually going to bring on our member institutions to discuss best practices to help make sure that you really shine in your virtual interviews, because at the end of the day, this is the one thing that the schools are going to be looking at in terms to see whether or not you're a good mission fit for them. And you want to make sure that you put your best foot forward during those.
Thank you so much. If it's okay with our panelists, I'll move to the next question. Is pre-recorded virtual shadowing an activity which medical schools want to hear about? Specifically, if it has been impactful in how we think about the material or the clinical component of being a physician. So how do you feel about asynchronous virtual experiences? Either of our panelists can weigh in on that question.
This is Christina. I'll jump in first. I think that you're going to describe your story to us in terms of what you've had access to or what you have not had access to. And if asynchronous is what you've had access to and you've attempted to do other kinds of in-person and that hasn't been safe or available to you, then we're going to understand that you've used video and asynchronous as a way to learn. And we're going to ask you to describe what you learned from that experience. I think definitely don't discount those kinds of experiences, especially if you've had aha moments or you have lessons from them, because in the end, it's the lessons we're looking for, not necessarily the amount of time you've spent doing something in person. And many of you maybe had in-person things earlier in your pre-med career, and then that stopped. So you're going to have the opportunity to show both in your application. So definitely don't discount those things. Tell us about those. I do think you want to think about doing some in-person kinds of things, even if it's over Zoom, in terms of interviewing a physician if you can in a safe way to ask questions. If you have family members with chronic illness, interview them and learn about their experiences in healthcare so that you have some things that you've done interacting with others, even if it's not the traditional shadowing or traditional kind of clinical volunteering that you may not have been able to do. But think about, other ways that you can interact with patients, even if it's somebody that you know, a friend who's had some kind of health issues, and finding out what their perspective is. All that learning will help. And I don't know if Rafael has some other ideas to add, or Enrique.
I think you should take advantage of whatever opportunities you have available to you, and if asynchronous formats are what you have, then that's what you have. But I do think that there is utility in doing these shadowing experiences, ideally in person, from really one perspective. It's not to show us that why you'd be a good fit for medicine. It's really, in my mind, to show you that medicine is a good career choice for you. You want to know exactly what you're getting into. Medicine is a fantastic profession. It's got a lot of pluses, but there are also some negatives. And you have to make sure that this is something you want to be doing for the rest of your life. And shadowing is one of the ways of identifying that fit for you.
100% agree.
Thank you. I have two related questions here about virtual classes and online labs. Although virtual classes and online labs are accepted, do applicants with all in-person classes and in-person labs have an advantage? The related question is, my college doesn't indicate on my transcript which courses are virtual and which are not. Will admissions officers ask me this question?
I mean, I can take that. I can tell you at NYU Grossman, we honestly don't care. All we care is that you got the knowledge. How you got the knowledge is entirely up to you. And I mentioned earlier that I'm actually a big fan of online courses and online labs. Why? I mentioned several of the reasons, right? The ease of use, the ability to scale to reach a larger population, the equity that can be found when you do it this format. But one of the reasons I like it is that it does have more skin in the game for the applicant in terms of their learning, right? As physicians, we have to continue to train ourselves after we graduate medical school. And much of what you learn in medical school will change over the years. So that continuing medical education that you have to be proactive about is essential. And the ability to demonstrate that to admissions committees by way of being an active participant in your online learning experience, to me, is a plus. So for us, it doesn't matter at all whether you're taking an online learning course or you've done it in person. And that's another reason why the MCAT matters, because the MCAT, then we have no prerequisites, but the MCAT shows us that people have the basic foundational knowledge to be prepared to start the first year of medical school.
If I could add to that point, I think the important takeaway is that everybody's in the situation where your classes moved online, where your experiences were canceled, and so just be patient with yourself, be patient with the situation, and just do the best that you can. If it's online courses, awesome, that keeps you moving. If it's virtual experiences, great. Just stay engaged, just as Rafael just said. And I think the important part is that you don't use a pandemic as a way to just stop on your goals of reaching where you want to go. I think it's guaranteed that we're going to be asking the question, what did you do during the pandemic to continue on your journey to becoming a doctor? And if we hear that you took a gap year and just opted to do nothing, or you took a couple of gap years and did nothing, I think that shows very poorly on you. So I think the alternative of doing nothing is so much worse than engaging in online activities, online experiences, and really just huge kudos to all of those that have continued to push forward on their journey, because it's never been easy. It's definitely not easy right now, but just by pushing forward, I think you're really showing that you're really committed to this pathway.
Yep.
Thank you so much. Here's another question about experiences. Do you feel that those with high SES backgrounds have an advantage in finding in-person volunteering opportunities, i.e. relatives or doctors, they live in areas with lower COVID rates and have more relaxed precautions? Do you have any recommendations for applicants who may live in other communities? Any of our panelists can take that question.
I think the virtual space has really provided a platform for you to engage with folks, either asynchronously by watching recorded videos or through live chats like webinars or things like that. And I think earlier it was discussed by Christina that engaging in activities like that is really helpful, but particularly what you take away from that is what's the most helpful. So whether it be, you shadow somebody for 100 hours and you reach your aha moment, or you do a virtual webinar on one of the systems of the body and you reach that aha moment that this is a pathway that you want to go into, that aha moment is what the schools are most interested in.
Can I just add, I just want to emphasize, you should be doing these activities because you want to do them, right? You want to be a physician because you want to help people, because you want to be involved in science. By extension, those activities you do are those that you want to do. So we're all very good at being able to find those opportunities that we want to do. And as Enrique said, the virtual opportunities really help level the playing field for those folks who might not have had the same access as before.
Thank you so much. We're going to make this our last question, and then we will do our wrap-up. So this one is, I became a caregiver for a family member during COVID. How can I make this experience relevant to my medical school application? And we'll ask Christina or Rafael to respond to this one.
Sure. So, and I think maybe how do you communicate how this is, not how you make the experience the right kind of experience, but how you communicate, because it already is, right? So you are caring for someone else. You should talk about that. You should talk about what you have learned in the process, what you've observed, how you've grown through taking care of another person. And I think that that is relevant, and you should share that. So I think sometimes we forget about sort of our personal lives and the things we do just because we're family members or because we're, that's just what we do, and we forget to communicate those things. I think it's fair to do that. I do think you need experiences outside of an experience where you're a caregiver for a family member, and diversify your experiences. So do think about how else you can grow in terms of other kinds of experiences, but don't discount those. And I'm going to add on to the last conversation. Holistic review is looking at each individual applicant, not what have you done versus the other applicant, but what have you done? What are your circumstances? What have you been able to do in your space, right? And so we're going to do our very best to figure out how COVID could have disadvantaged people, particularly people who are already at a disadvantage, and we're paying attention to that. And I just want you to hear that message.
Yeah, I don't have much more to add. I think Christina answered that perfectly.
Thank you. And thank you so much to our panelists. We want to remind all of our participants today that you can continue asking questions of our panelists by visiting the booths of the AAMC, NYU, UAB, and Tmdsas. I also wanted to remind you that the AAMC has created a few different resources to support applicants during COVID and beyond. Number one, we have a section on our website for applicants entitled COVID-19 Resource Hub. It has recommendations, information about virtual interviews, changes schools are making to their admissions policies, et cetera. So several things you can find to be relevant to preparing your application in the midst of COVID. We also made our MSAR advisor reports publicly accessible. So if you are a pre-med advisor or a pre-health advisor and you're looking for information to support you in advising your students in the middle of COVID, you can navigate to our website and locate the MSAR advisor report. If you have any difficulty locating those resources, feel free to visit our AAMC booth today and we can help point you to those. I also wanted to remind you that all of our presenters will be available in their booths to answer questions and also to give you additional information and to let you know that this presentation is being recorded and you can access all materials from the fair, including this presentation, until May 22nd. Thank you all for joining us today, and we wish you a wonderful rest of your day. Enjoy the fair, talk to the booth representatives, and good luck in your medical school application. Thank you.